Thank you, Rachel, for that kind introduction. My name is Erfan. I am a third year general surgery resident at SUNY Downstate, currently doing 2 years of dedicated research. And I've also had the privilege of serving as the health policy and advocacy resident liaison for the cohort through the advocacy. As a way of introduction, the HPAG cohort has a very diverse and experienced set of representatives from all over ACS. Some of the members include faculty on the Board of Regents, a lot of the staff members from the DC office, and members at large from not only general surgery, but various surgical subspecialties, current and past ACS leaders, our AMA House of Delegates representatives, and also some folks from the younger generation through the Young Fellows Association, and also the Residents and Associate Society. Some of the areas of focus that the cohort has have been identifying public policy issues and concerns affecting surgeons and patients, both in academic or private practice. We also identify focus areas for ACS and recommend such priorities to the Board of Regents. Have been an expansion of mechanisms by which ACS makes surgeons and patients aware of the health policies that are being proposed, and also there's always an initiative to develop pathways through which legislative and regulatory issues can be addressed. The DC office in particular carries a lot of the weight of the advocacy after the discussions that are had with HPAG, and they make sure that they take into consideration all the members of Congress at every legislative cycle and what their priorities are, and how we as a society can best align and provide our expertise as surgeons to them in making those policies. The current subjects that are being heavily debated and also advocated for right now are Medicare physician payments and prior authorization reform. They've both been subjects of heated debate, both among surgeons and also on the legislative body as well. And those are some of the areas that the DC office have been heavily involved with. There's been a very strong initiative to encourage and strengthen the surgical workforce. Tremendous progress with improving trauma care throughout the country, and accessing to appropriate trauma networks that the the Advocacy and Issues Symposium is going to address pretty significantly at the Advocacy Summit. The increasing public health research funding has been a highlight for the committee. Reassessment of non-complete clauses are an ongoing issue, and also to clarify and further update the coding and reimbursement policies. And lastly, for opportunities of engagement, there's a variety of avenues that residents and RAS in general can actually participate and become very active members with the legislative body. So the primary, I think, is the Leadership and Advocacy Summit. There's been a big push to provide or ease the process by which residents can actually engage in advocacy efforts pretty early on with the scholarships that are being provided. Unfortunately, this cycle, I think the scholarships are already closed, but there was a lot of push, and I think a lot of interest on members who applied and took advantage of the opportunity. But even without the scholarships, if folks have the opportunity to attend, the registration is still open to attend the Leadership and Advocacy Summit from the 15th to the 18th. There is also our, as Dr. Koo mentioned, our issues committee meetings every month. We meet at the first Wednesday of every month at 8 p.m. and Brad, as always, is very kind to send reminders and also engage as many of the members as possible. So definitely encourage that, especially for folks who have never necessarily been part of advocacy efforts but would like to get started. I think that's a great place to start. And also, as with any kind of advocacy, engaging your local and federal representatives is a huge component. If you have any issues that are not necessarily on the forefront of what ACS advocates for, but are very important to you as a trainee or as a young faculty, I think it's very important to voice those concerns and be an active member with the process. And As your representative, I'm always available for communication. Communicating your concerns to HPAG is my privilege, and I have shared my email and also my Twitter as well. If anyone would like to reach out during those avenues, I would be happy to. And I appreciate everyone for the opportunity to discuss some of our works with HPAG.